The Cape Town AF Centre is one of the leading centres for management of cardiac arrhythmias on the African continent. Located at Panorama Mediclinic, the centre is headed up by cardiac electrophysiologist Dr. Razeen Gopal.
The Cape Town atrial fibrillation, based at Panorama Mediclinic, has been in existence for the last 9 years. In fact, we will be celebrating our first decade of practice in January of 2021.
With a team of experts who help to accurately identify heart rhythm disorders and help correct them as effectively as possible. These experts have gained international recognition in the field of research, diagnosis, and treatment of all cardiac rhythms, including fibrillation. The centre believes that the heart is quite a complicated pump, and it can only function properly if it contracts at the correct and regular rate and rhythm. They offer cutting-edge treatments for AF and all other rhythm disorders, making informed decisions based on opinions informed by latest scientific data.
We offer the full gambit of electrophysiology services, including His bundle pacing, as well as micro leadless percutaneous pacing, as well as subcutaneous ICDs, which are the new leadless defibrillators. That's from a device perspective. Naturally, from an ablation therapy perspective, treatment for all conditions, including atrial fibrillation, ventricular tachycardia, and supraventricular tachycardias, are performed on a daily basis.
Their successful team, led by Dr. Gopal, includes specialist cardiac anesthesiologists, clinical technologists, a dedicated cath lab staff, radiographers, and specialist arrhythmia nurses, integral to the follow-up of patients, as well as the coordination and maintenance of the AF ablation program, which has seen resounding success. Dr. Gopal has been a fellow to some of the most renowned electrophysiologists in the world, having been mentored by Professor Richard Schilling, current president of BHRS, British Heart Rhythm Society, as well as Professor Hein Heidbuchel, current president of EHRA, European Heart Rhythm Association. As a centre of academic excellence, they have taken a leading role in the dissipation of knowledge in the discipline of cardiac electrophysiology, both in cardiac ablation and device therapy. In addition to their avid passion for teaching, the centre believes in giving back. Included in their numerous outreach and educational programs, Dr. Gopal has proctored cardiologists and electrophysiologists locally as well as abroad, including the Middle East, Namibia, Indian Ocean Islands, as well as its humanitarian program in West Africa and Dakar, Senegal, where dozens of patients with life-threatening WPW syndrome have been cured.
The vision of the Cape Town Atrial Fibrillation Centre has always been to offer high-end first world therapy to all our patients and make this kind of treatment available and accessible to all. The motto of the centre is with innovation comes cure, and as a consequence we have served as a launch pad for a number of leading technologies over the past decade, and from this tens of thousands of patients have reaped benefit.
The logo represents the chambers of the heart, incorporated into the wings of a butterfly. Over the past decade, the Cape Town Atrial Fibrillation Centre has offered thousands of patients freedom from cardiac arrhythmias. Cape Town Atrial Fibrillation Centre. With innovation comes cure.